Hello to everyone. So my name is Monika Frenzel. It's a great honor for me to present some of the activities of ICPerMed that are the mapping activities, and one of the main outcomes so far from these activities, the ICPerMed database on funding programs in the field of personalized medicine. I hope you had a great first half day. It was very impressive, the first best practice example. And before we are coming to the second one, it's really great to give you some feedback from ICPerMed itself. So before coming to the database, I would like to come back also to the title of the conference, Personalized Medicine in Action. And I think ICPerMed is exactly this for me. It stands for let's talk about personalized medicine. Because if we would like to advance in this field, this is exactly what we have to do. So we have to demonstrate, as we are doing here during this conference, the different approaches towards the implementation of personalized medicine in the healthcare system. We have to talk about it not only on national, regional level, but if possible, even on a more broad level, European up to a global level, to share knowledge and experiences about personalized medicine. And if possible, we should do this with a common understanding of what it is when we are talking about personalized medicine. And the most important, and I think we are moving forward in this point, we have to demonstrate that in fact it is possible to move on from a simple theory to something that is going into practice. And for me, ICPerMed is standing exactly in the middle of all these different points and enables the exchange between the different key players in this field, for example, by the different events as this conference. So I also took the vision statement here again on the slide. I highlighted some other keywords as European global support, coordination approach, and all this for the benefit to citizen and healthcare system. So what we need to know and what is helping to move on to broader approaches in personalized medicine is to know what is already going on the regional and national level. And therefore, ICPerMed started extensive mapping activities to map different actions in the field of personalized medicine. And we are in a quite comfortable situation as we already contain in ICPerMed more than 40 European and international partners. We all agreed on a common understanding on what it is when we are talking about personalized medicine. And we developed a common work program, the action plan that was released in March 2017. And ICPerMed aims to follow up on the implementation of the different action items that are included in this action plan. We are having in total 30 actionable research and supporting activities. And we need the mapping activity in the first place to have a collection of all the different actions. And in the second part, then we can start to follow up on the progress of the different actions. So the objective is to set up an inventory of regional, national, European, and international activities in the field of personalized medicine to increase the knowledge base for funders, stakeholders in PM research. And of course, most important, and I think we will hear this more than one time during this conference, we need to avoid duplication of efforts. So if we know what is already going on national, regional level, probably we could, instead of reinventing the wheel, just use more efficiently already existing infrastructures or platforms. So how we are doing all these different mapping activities, we have internal reportings or internal ways to get the different information. First of all ICPerMed members, when joining ICPerMed, signed a letter of intent, and in this letter of intent, they said that they will share their results, data, and information about activities in personalized medicine in their country and or region. So we are having internal surveys and reporting. Then, of course, we get a lot of input from extern. So, for example, via conferences or workshops organized by ICPerMed, and by exchanging with different stakeholders. What are we doing with all these results? So we are creating, of course, a different kind of reporting or reflection papers. We develop research policies, strategies, and guidelines. We are publishing different kind of reports, as for example, as mentioned today already, the annual state-of-the-art report. The first one is already online on the ICPerMed website. And we developed an ICPerMed mapping database where all the programs allowing funding of research in personalized medicine are collected. And I would like to talk about this mapping database more in detail. So we are having different activities, as I said, mainly we started with the funding activities in personalized medicine and program level. We have also other activities we are looking for, so different initiatives, platforms, infrastructures, and also, as mentioned, we are searching for good practices. The first survey to get information for the funding activities in personalized medicine was launched in March 2017, and we concentrated in this survey on the program level, so what programs are existing or running or will run in future to fund research in personalized medicine. And this very same time, we collected information about the different funders, ministries, organizations that provided the respective information. All the different data are collected and presented on the ICPerMed database that went online finally this summer, this year. The database is directly connected to the ICPerMed website and is open to the public after simple registration. And what it is, it's in fact, if we would like to say, it's a simple list of the programs that we collected. You have different filters you can use to search the program you are interested in with different filters that you can see here. And so far, from all the countries that are participating in ICPerMed that are marked here in blue, UK is marked in red as they have been a member and they are not anymore member of ICPerMed. We have already nearly full coverage, so from all the countries that are marked in green here, we are having already information available on the database. And as the database is updated regularly, we hope soon that we will have the full coverage and full image of funding activities in the ICPerMed participating countries. So what kind of information you can get? As I mentioned, you get general information about the funding organization ministries that provided input to the database. For example, you can get general information about the funder's name and the website, contact information, and the general funding information, so what kind of research is funded, the budgets, and some other information. And of course, the main part of the database are the programs, and there we have a different information, as for example, general information about the name, the website, and this is, for example, interesting also what kind of program it is. Is it a program dedicated to personalized medicine, so that was created in purpose directly for the aim to fund personalized medicine? Or is it a program that is allowing to fund research projects in the field? We have general funding information. Is it a program on regional, national, or international level? Is it funding basic, translation, applied, and so on, research? And we have different contact information available for the coordinator, if available, and for the national regional contact. So in total, we collected already 136 programs. As some of the programs are international programs, they might appear more than one time on the database for the different funders. So in total, we have 97 different programs. And here the color code on the map is simply showing in darker those countries. For those, we have a lot of programs available on the database. The very same picture you can see here, just in another graph, the number of programs per country. I would like to mention here that this is not showing all the different activities going on in the different countries, as mostly we have one or, well, for some countries several, let's say two partners that are giving the respective funding information, but that does not mean that we are having the full picture for all the different countries on the program level. So we are working on this to complete as good as possible this picture. I would like to show you now some more in-depth analysis that are not like this available on the database, but I think it's interesting to have a more deep look inside the data that we collected. This is very important also for ICPerMed. So we can not only distinguish between or we can not only count the number of programs per country, we can also distinguish between programs that are in green dedicated directly to personalized medicine. And here we can see already that there are some differences in the priorities in the different countries. We can analyze, is a program running on an international or a national regional level? Also here it's interesting already to see that there are quite some differences between the different countries. And we can see if the different programs running are on international or national regional level, dedicated to personalized medicine, or simply allowing to fund projects in this field. And also here we see that there are differences already in the priorities when we compare the different countries. This is interesting, and somehow I thought about that this is also interesting compared to the first best practice example we had and what was mentioned about funding given to what kind of research. And here the bars are not reflecting now the number of programs directly per country, as some programs allow to fund basic and translational and, for example, applied research. So here you have the whole picture of, let's say, programs per country allowing to fund the different type of research. And it's probably not so easy to see for you, but there are, let's say, basic and translational and applied research are more or less funded in the same ratio by the different funding organizations or ministries. In the programs that are on the database, a little bit less funded is everything that is clinical research, and compared to the others, there's only few funding going to industrial research, but also I think here there are some differences between the different countries. The next slides are very important for ICPerMed as they show and demonstrate the advancements of ICPerMed and the progress in the implementation of the action plan. As I said at the beginning, ICPerMed aims to implement and to follow up on the implementation of the action plan, what is done mostly by funding on the national, regional or international level between the different funding agencies, but not within ICPerMed itself. And all the different programs on the ICPerMed database are connected to the action plan, to the different action items. Here you have the list of the different research activities. We have 22 research activities amongst the 30 action items with the different subcategories: data, technology, methods and processes, people and cross-cutting. And what you can see here already, that funding is not equally provided to the different topics. So there, I would say from A1 to A15, it's quite similar, but then we can see clearly that there are some action items where the topic is not yet included in funding programs. Probably within the future, within the next years, there might be a shift towards the other action items. Probably since they will be included in programs, we need to do other steps in advance. This is very important, as I said, for ICPerMed, as with this analysis somehow, the database also reflects the progress of the ICPerMed consortium towards the objectives and the implementation of the ICPerMed action plan. Here's the same picture for the research supporting activities, as Mayreed also said nicely. In fact, these are probably a bit more complicated action items for integration in funding projects, as they are more on policy and support. So this is also reflected here in showing that there is, so far they are integrated in less amount in programs that are on the database. And when we look at the international or how the action items are funded on international, national, regional level, you can see that there is a lot more for some action items going on the national, regional level still. What is even more visible for all the policy and supporting activities. So these analyses that I presented now, and even hopefully more depth analysis, will feed into the next state-of-the-art report of ICPerMed, together with other results of mapping activities. The state-of-the-art report 2018 will be published hopefully beginning of next year. And if you would like to have a look on our first state-of-the-art report, please visit our ICPerMed website. We are having already over 150 registered users on the database, and if you did not connect so far, if you did not register, so please feel free to have a look, and we would be happy to welcome you as a new user. Therewith, I'm at the end of my talk, and I would like to thank especially all the ICPerMed members that provided all the different information. It was a quite huge survey, but I think the outcome of the mapping activities are promising. And thank you all that you are here for exchange, for presenting all these best practice examples. I think this is really what we need to move forward in personalized medicine. Thanks a lot. Are there any questions? Are we still in time? 2 questions.
Thank you very much. I'm wondering if at some time in the future you're going to be able to analyze whether there are better health outcomes in the countries that have funded personalized medicine approaches relative to other countries.
That's a good question. So what we try in ICPerMed also is to follow up on general activities within the different member states, and of course also by the feedback from the different ICPerMed members within the consortium, to have a feedback on ongoing activities and on how we approach in the implementation finally of personalized medicine. So this is something that we hope to have as information in future, of course. There was a question here in front.
Yes, you didn't provide figures about the size of the program. So you may have 10 programs, small and a big one. So in terms of amount of money, do you have any idea?
Thanks for the question. In fact, it was something that I missed to mention when I showed, for example, the different graphs. So far, we have a clear picture about the numbers. We have for some programs already input also for the budget, but I think we showed a kind of priority on the number of projects, but programs. But this is of course not reflecting the same as one. For example, if I take the case of the French National Funding Agency, we are having one national program, but this is a general one for all France. So of course we are investing a lot of money, but on the graph it gave the impression that we are having only one program level on the national and a lot on the international, but it's not reflecting always on the budget. So these will be analysis that we try to include in the future, but we are not having the complete picture yet. But of course, this is showing much more still priority than just simple number of programs. I agree.